studies have shown that the more the child is exposed to screen time or the longer duration, which is more than the 1 hour recommended in a day, then they can actually develop delay in their speech. A lot of people say like, you can't learn parenting, or there's no formula to parenting, which in essence is true, but there are different styles of parenting. So then they're likely to get diabetes if they don't have good quality and they're eating overly processed, high calorie foods. Then they're going to develop obesity most likely.
Hello viewers and listeners, welcome to another episode of my podcast, where we elevate your well-being and health at once. I realized 60% of the viewers of my channel, or people who get exposed to this content, have not yet subscribed. So I urge you to do that so that this information may reach more people and we may empower more people. One and the only, the pediatrician with the biceps, also known as Ask Dr. Rain. He is a pediatrician. He's someone who's having an impact on the society. Despite doctors being busy, he's always out there educating through short videos, replying to people both online and offline. And he's someone who's having a lot of impact on people. And for that reason, we decided to have him in our podcast. Today, we'll talk about everything about pediatrics. Another thing is a disclaimer to put out there is every pediatrician was once a doctor.
Yeah.
So yeah, he can also comment on things which are pertaining on adult health.
Yeah, true.
Welcome, Dr. Rain.
Asante sana. It's a pleasure. It's a pleasure to be here. I like what you're doing. Keep on doing it. You're doing it at a really, really high quality as well. So it's, I'm just very, very impressed. You're shooting, you're producing, you're doing the post-production. You're like a whole production house. So that's really nice, man. And it's a pleasure. It's a pleasure to be on these platforms.
Thank you, Dr. Rain. I realized just a few minutes ago I was on TikTok and viewing one of your videos. What does it take to be a doctor, and at the same time you're trying to make content out?
So most of the times, it can be really, really busy. Sometimes you want to be more consistent in content creation, but the way our work is set up, it consumes a lot of our time. So, but what I try to do is I try to be the content. So maybe I'm working and I've seen a couple of patients and I'm shocked about something, like they don't know about maybe the symptoms of malaria, or they don't know about the symptoms of dehydration, things that we consider basic. So when I get those encounters, then it usually motivates me to do my videos. So initially I used to try and do very high quality videos, to do them perfectly with the good quality cameras. But the problem with going that route is that, number one, it's not only very expensive to put out such content, but it also requires it takes time. You have to shoot, you have to go to a location, you have to do post-production and all that. So that's when I not discovered, but I started doing the short videos using my phone in selfie mode. That way I can, before easily, even that idea goes
away, you've already...
Yes.
Wow, that's
what... Yeah.
That is really an exceptional way to think about it, or even to do it, because many people consume themselves, including myself, in trying to make the things right, until even at one point the idea even goes away.
Exactly. Yeah. You know what I mean.
So Doc, what has been your path to being a pediatrician?
The path to being a pediatrician has been a hard one. It's been a lot of pressure. I never wanted to be a pediatrician. I was one of those doctors who said, I'm not going to fall to the pressure of, internship, finish internship, become a medical officer. Immediately you become a medical officer, do your postgraduate, because we want to do things so quickly nowadays. So I just told myself, I'll go with what I'm interested in. I was actually interested in surgery. But then where I did my internship, which was Kenyatta National Hospital, I wasn't exposed to as much surgery as I would if somebody did internship in like Thika or Machakos, because there you have the
surgical
registrars,
and they do almost everything.
And they have also to make sure that they meet certain surgeries to be able to pass. So it just came about naturally, but I became interested when I became an uncle. So my niece plays a big role for me becoming a pediatrician, because then I started being exposed to pediatrics more. I started seeing another side of kids. I also started seeing the gap. Once I started being mentored by other pediatricians before I became a medical officer. So there's a big gap in pediatric knowledge, in basic knowledge, and I thought, everything was gearing towards that. When patients see you and you're still a medical officer and they think you're a pediatrician and they ask you, where's your clinic? Then something in your head starts telling you, okay, maybe it's time. But also a lot of people around me pushed me as well. Pediatricians would always tell me, you should do this. It suits you.
What can you say are the essential components of raising a healthy child?
First, they need to grow up in a very nurturing environment. So they need to grow up in a place where the mother and father of the child are preferably present, or if it's not the actual paternal father or it's not the mother, there's somebody there. If people are co-parenting and it's a nurturing environment, the parents are not arguing all the time, they're not fighting, they're not abusing substances in the house and things like that. So a nurturing environment is very, very important. Of course, when I mean nurturing, it's all aspects. You have to look at the child's nutrition. Kids have nutritional needs. Especially when they are toddlers and below the age of 2, it's very important that they have minimum diet diversity, and this is making sure they have all their macronutrients and their micronutrients within the day. Your vegetables have to be there, your fruits have to be there, your dairy in terms of yogurt or cheese. The small ones who take formula is considered also dairy. And then your carbs, your carbohydrates, whether it's plant-based, whether it is more high fiber like sweet potatoes. But sweet potatoes are classified as vitamin A vegetables and then vegetables. So now you have vegetables and then a group called vitamin A vegetables, which is your sweet potatoes, your carrots and things, pumpkins, all that stuff. So those small kids' nutrition, psychologically as well, there's different types of parenting that we know about nowadays, and unfortunately a lot of people say you can't learn parenting, or there's no formula to parenting, which in essence is true, but there are different styles of parenting, and research has been done on the different styles. Like there's authoritative parenting, which I think most Africans have where there's the man of the house, and what he says is what the goes. End, is what goes. There's no time for discussion. There's no democracy. If you cross the line,
so it's more of patriarchal.
Exactly. So it's patriarchal, authoritative. So think of like a dictator. So that's one style of parenting. So it's also been shown that the studies, that type of authoritative parenting isn't healthy for a child. Then you have permissive parenting, where you're giving your child almost everything. You don't want the baby to, when the baby is crying for anything, they want sweets, they want this, they want to watch more TV. You just allow them to do whatever they want, which has also been shown to not to be as healthy. So there's different types of parenting. So that's just in terms of parenting and the psychology aspects. But in essence, just nurture from nutrition, psychological, on a social standpoint. They have to also socialize. there's something that people need to know about is called adverse childhood experiences.
Yeah.
So it was a study called the ACEs study that was done, and they looked at the different things that when children are exposed to adverse childhood experiences, most of the things that I had mentioned, like domestic violence at home, substances
Traumas.
in the house, trauma, physical abuse, be it sexual abuse, gender-based violence, abuse of the kids, neglect, all those things actually impact. So it's for that person to actually be able to survive. If the kids there's usually like a scale based on certain you take, and then the way we score certain things,
they
so,
can adapt to become
exactly. So if you have a very high score, then you're at risk of developing depression, anxiety, exactly. So high suicide
so you start
rates.
manifesting the things that you suffered early on in your life.
So when you see men depressed or you see a high suicide rate, it's always good to look back to see this population and how they were exposed as children that has also predisposed them to such things. So that's why I like pediatrics, because if we give you the knowledge at an early stage, then we can prevent all this money on antidepressants and pumping us with toxic drugs
and all this stuff.
Where it's prevention.
So good parenting at an early age. As a pediatrician, you get to help the parents to cope up with the child in their life. At the same time, the child to cope up with their parents in their life.
Yes,
that's really
and
remarkable.
Building good, healthy resilience. So when even adverse things happen in life, if loss and things, it's because of you've raised them in a nurturing environment. They have better resilience and better coping mechanism. Yeah.
Wow. Recently, I watched one of your videos that was talking about childhood allergies. How do we identify them early?
Well, if you see good pediatricians, and the more pediatricians we need out there to pick them up, we pick them as early as when they're babies.
Wow.
Since they're newborns, we see a lot of some babies having manifesting eczema, proper classical eczema signs, atopic dermatitis, that is. So if you have somebody that is knowledgeable, and you see a doctor that can be able to take a good history, because you don't really need to be a pediatrician, but you have to have, as a medical officer, you need to have some love for it, or do a couple of CMEs, because these are things I was picking up as a pediatric medical officer. So things like eczema you can pick up. So if you take history and you see that in the family that there's genetic predisposition, or there are members in the family dealing with eczema, sometimes it's not the skin, because allergies, atopic dermatitis usually comes as a triad, as three things. So you have the skin, which is classical, that's the largest immune organ, and then you have your nose and your eyes, or the T, which you get allergic conjunctivitis, red, teary eyes, and then the nose, either severe congestion or a lot of runny nose, or sometimes it goes hand in hand, where it's like runny 1 minute and then the other time it's very congested. Yeah. Oh. And then the other one is the chest, which is asthma. So it's acute rhinoconjunctivitis, asthma, and then atopic dermatitis. So the 3 A's.
Oh,
yeah.
Another thing I've meant to ask about allergies is, are we over treating allergies? Because I came across the concept of I think it's a kind of a theory in US, whereby there is a time they stopped giving peanuts to kids because kids were overreacting to peanuts. So over time, what they came to realize is they stopped kids coming with peanuts to school. And then 1 year down the line, I think they realized that more kids are reacting now to peanuts because they are not getting exposed to peanuts. What does exposure, how does it play a role in allergy prevention?
So it starts off very, very early. And it's actually interesting because allergy is actually an area that I'm getting more and more interested in. especially in subspecializing now that I'm a consultant pediatrician. So the allergies can form from very, very young. And what you're saying is absolutely right, because in the past, even as pediatricians, we used to try and avoid introducing highly allergenic foods when we start complementary feeding at 6 months. We used to say, don't eat eggs, wait until 1 year because eggs are highly allergenic, or peanuts, avoid the peanuts. But we're starting to realize that the more you start exposing your body to this allergen, and most of the times depending on the quantities. Yeah, so the more we're exposed to some allergens, the body can react differently, especially when you're starting from an early age. Yeah, when you're introducing foods. So for example, when I start telling mothers to introduce foods from 6 months, because the science has changed, I'm telling them, don't restrict. Introduce that egg, introduce that those, of course now will be peanut butter, the crushed peanuts or whatever. Dairy, introduce the dairy, introduce the meat. Don't be afraid, introduce the fish, the prawns, because it's only at that age that you can actually start
sensitizing the body.
Exactly. To put it as simple as possible, that's all you're doing. Like,
you're just teaching the body to tolerate these things.
Exactly. And where eczema and allergies come in place is because the skin is your largest immune system, and it's your primary defense is your skin. So when babies have eczema and they have very rough skin, what happens is that you find that these allergens sometimes enter the body via the skin. So when you have very rough, scratched skin, open skin as a baby, and you're frying fish in the kitchen, those particles of fish end up on the skin, and then they enter the body, and then they for them it's a foreign body.
Yeah.
So then the next time the baby actually now eats it, doesn't go through the skin, but is eating it, it's already been identified as a foreign body. So then you start developing an allergy to fish. If you are boiling milk and the particles are there, you start having like a very strong cow milk protein allergy.
So the skin becomes the first receptor, sensitizes your immune system.
Yes.
And then later on, when you consume the same thing, you start reacting to it.
Exactly. Through the gastrointestinal system. And that's why the microbiome is also very important.
Very important.
It's
I saw one of your videos, you were talking about microbiomes.
Yes.
I almost watch all your content.
Thanks, man. Thanks for... I try to just put the information out there. And it's fairly new, the science in terms of evidence, because there's different strengths of evidence, but it's very promising as well, as much as there's some not as advanced in terms of research of the microbiome, but it's very encouraging from some of the things we see. Yeah.
So what does an ideal nutrition plan looks like from a baby? Let's say when we group them, infants to babies up to 2 years.
I would put them in one category. So what I had mentioned earlier was the minimum diet diversity of making sure you have your carbohydrates, your vitamin A, vegetables, those things. So first is the basic diet, but it's also the quality of your food. So you want to go less processed foods, and processed is anything that is in a box, or you need to put it in a microwave. Something that has been made easier is usually not healthy. So you want healthy, wholesome food. The fresher the vegetable, the less processed it is, the better. Yeah, so as long as they're having that, and then of course, when they are 6 months, you start introducing. So you start by blending, then you puree it, then later on you mash it, then you start giving the child now more of coarse food, and then eventually you're letting the child feed themselves. So these are all things that parents must do. The babies don't just learn how to chew by themselves. They have to learn from now. You've been taking liquid breast milk, and then now we have to puree it, make it thicker. Now we have stronger gums. Now we have teeth. Let's start chewing all the way. And then once they do that, is until 2 years. What we say is from the first 1,000 days, what you introduce to your child, that first 2 years can change the way the outcome from acquiring non-communicable diseases. It's known as the first 1,000 days of life. So if you're going to give your baby overly processed foods, sugar, and all that stuff, then you're also the same way with the allergies, the way we are, sort of like
orienting the immune system.
Yeah, sensitizing is the same way. So they're likely to get now, because you're already playing with the insulin in the body and everything. So then they're likely to get diabetes.
And all that,
if they don't have good quality and they're eating overly processed, high calorie foods, then they're going to develop obesity most likely. And other things, cardiovascular diseases, hypertension, all this based on food, just food primarily. So it's like the ACEs study, how it prevents other adverse psychological events. You have your first 1,000 days, and that also, but it also starts with the mother. So when the mom is pregnant, it's not like she can just eat ice cream and pizza anytime she wants. Of course, there are those cravings you try to, but you try to minimize, because then it's all epigenetics, where it will affect. Now you'll be changing the way the gene is supposed to be. Yeah.
So like if you're a mother and you're pregnant and you're consuming a lot of sugary stuff, you're a healthy adult human being, so your pancreas overproduces insulin to counteract the excessive sugar in your body, and that same insulin is still perceived by the child.
Yes,
and then
because they're attached, the placenta, they have the same blood supply. So all whatever is in the blood, that high level of insulin, that insulin resistance fluctuating, and it does something. And we see that especially they develop gestational diabetes, and then they have very high blood sugar, and then they end up having very large babies, or macrosomic babies, because of the high sugar. So of course the baby grows much bigger, but then that puts the mother at more risk, especially if they're in a place where getting an emergency cesarean section is something
a
difficult.
problem,
because they get babies as big as 5 kgs.
5 kgs.
And if you can't push that out normally, then it's going to be a problem for the both of them.
Another thing I came to realize while still talking about the concept of nutrition in pediatrics, we sometimes feed the kids for a longer period of time. Like you realize a mother feeding a 4-year-old baby. I mean, what role does that play in the child's health?
That's something I'm really trying to change, especially in my practice. When I see the kids, the toddlers, and the parents, I try to encourage independence, because, like I said, it's not like the child knows that when I turn 1, I should be able to start now eating properly and being independent, or when I turn 3, I should be able to go to the loo without using diapers. So it's up to the child, because I have seen situations where they're still blending the food. The child is 1 year and they're still blending the food. They're blending the meat. They're doing everything. And then it's 3 years old. The child is still eating mashed food, is still being fed.
So this affects the gut. This affects the oral development of the baby.
Those are all milestones. So the beautiful thing that happens in kids below 2 years is the brain. It's neuroplasticity, and how now the brain is starting to network. It's the foundations that we're building. And based on the foundations, if you build a weak foundation, then you become more susceptible to diseases, non-communicable diseases. You build a stronger foundation from the neuroscience and from building these neurons. So once they learn how to chew, that the brain is telling, so this, when you put this texture, this is what you do. You have to start chewing. And these are all, there's a lot happening. There's a lot of electrical activity happening, synapses in the brain during the first 2 years of life. So you start building that. And if you don't encourage that, then 4 years, your child won't be able to do it. A lot of the things mothers are afraid of is, I'm afraid my child is going to choke. That's one of the reasons why they always blend and things like that.
And all that.
Or I hear my child sometimes start like gagging and stuff like that. But I tell them, the same way we're building and learning, they have to develop a protective reflex
Reflex
in the brain. So they have to have a good gag reflex. They have to have a good swallow reflex. They need to also be able to have a good cough reflex, so that when it's going towards the windpipe, they are able to cough and
to reject,
push everything out. But if you don't do that, and they don't know what it feels like when it's going the other way, if you don't expose them to that, sorry to say, they won't build a good reflex. Yeah.
Another thing that I realize is really key in parenting or even raising up a newborn or even a child is the role of activities, the role of, exposing this child to exercises and outdoor activities as early as possible. What role does it play in health?
Oh, it plays a big role. We now have so there's guidelines now for kids, for toddlers. There's and it's two-way. It's looked at screen time and it looked at physical activity, because both of those reduced physical activity is associated with increased screen time. So the more you're a couch potato, the more you're going to become heavier and obese, and then it brings about all these other diseases, other opportunities for non-communicable diseases. So the WHO has guidelines. So below 1 year, we don't recommend any screen time. And then also the playtime, below 1 year, you want them to do at least 30-45 minutes or so. And then from there, there's different ranges from 1 to 3.
3 years.
Yeah, but you want at least and they separate. There's rigorous activity, which involves like playing around and things like that. But also recently released by WHO was the benefits of resistant training in children, and how it's also helping them build, not only just be stronger but healthier, and also reduces the chances of certain diseases as well. So it's not just running around. Kids should also start resistant training as early as possible. But of course with trained,
with caution.
Yes, with trained people and things like that. And then screen time not more than 1 hour in a day. Usually even for 5-year-olds, 6-year-olds, people don't actually know that.
It's very unfortunate we see parents trying to calm down their young ones by giving them phones, by giving them gadgets. And you see the child using the gadgets for a very long period of time. I came across recently a video, I don't know if you have seen, a child who's sleeping, but his hand is moving as if he's moving from one shot to another.
Oh, really? I haven't seen that one. So it's a big problem we're having. I'll be frank. Now that I'm a parent, I do understand why parents do that, because it's an opportunity, especially for in a situation where you need your child to be still for a few, so that you can do something. That is different. But then letting them sit down for 2 hours, 3 hours, just watching a screen so that you can do something. And what usually happens is, studies have shown that the more the child is exposed to screen time, or the longer duration, which is more than the 1 hour recommended in a day, then they can actually develop delay in their speech. Not only that, is the reason why the kids nowadays are more on that. And a lot of us usually like to blame the kids and say that they're now on their phones a lot or screen, is because we are always on the phone. Our generation, from
so we're just
millennials,
projecting.
Gen Z, I mean, yes, the child shouldn't be on the phone, but they should be doing something like playing with toys. It's the same thing, because sometimes I also have to check myself. Well, especially when my child is like, my son gets cranky and things like that. It's because I realize, okay, I'm here swiping left and right. I'm not giving him the attention that he needs. And that's why he's cranky. And if he gets the phone or he gets the TV, then it's both of us still addicted. The only problem is now they throw tantrums because they don't know how to control their emotions. So it's very tough. I would encourage people to, what happens is the mom will go to work, the dad will go to work. You leave them home. You have somebody watching your child, but the same person watching the child has to clean the house, has to cook, has to do whatever. So for her, so that when the people who have hired her don't get angry that you haven't cleaned the house, you haven't cooked, because if they come back and say, well, how come this is not, you said no, I was with your baby, then they're going to be like, okay, now we have to revisit this conversation. So she's going to switch on the YouTube, the iPad, so that she can stay still, so
do
that
her work and still
cook, I can clean. And I've seen this even in my practice, is kids who get that type of situation, it usually takes much longer for the child to talk. But if you can get somebody to sit down with the child
and interact with the child more.
Yeah, and honestly, to be honest with you, screen time, I'd like, it's a topic of, we need more research into it, because there's also some educational things that are on the screens that the child gets exposed to that actually benefit and improve the speech. Like, I hate doing this, being, oh, my son, but I'm just going to say, like, for
your pediatrician who has a son. So
so I'm seeing how is, like, there's certain things he watches has impact. Like, he knows a Lamborghini, a Ferrari.
Yeah.
He knows like, he's 2, but he knows a bulldozer, an excavator. He knows the engine. He knows the dipstick. He knows this is the gear. This is the steering wheel. This is for the wipe.
So there's the educational aspect.
There's the educational aspect. So when I, like, put him in the car, I wonder, like, how come he knows all this stuff? And when I speak to the mothers, like, no, there's this thing he watches. It has this. So it's increased his vocabulary. It's increased his knowledge of, general things. He knows a lorry. He knows this is a car, So it has its positives, I believe.
Yeah.
But if we don't do more research into it and understand just how this impacts, it's different. But also, we're going to have a different generation of kids. They're going to, it's going, because they're being exposed at a younger age.
That's
so
the thing, definitely.
I think that's also something we have to consider.
Another thing is, you mentioned the aspect of you're talking to the child and they're still using the phone. So I was thinking of this analogy is where the mother is talking to you and the child is trying to talk to the mother to show them something. So they're seeking the mother's attention. Mom, check this. And the mother is talking to you, or you're talking to the mother. Do you tell the child, wait, and you teach them to be patient and not to disrupt communications between two people? Or actually you give attention to the baby and that you stop your conversation?
So that would depend on the child's age, because I believe everything is, like, age appropriate. Like, a 2-year-old or a 1.5-year-old, where they start saying, mom, they don't know what conversation you're having. They don't know whether it's serious. They don't know that they're being rude or it's not polite to. But once, a child is like 5, 6, this is the time now they're starting to understand. It's milestones and brain development. If your child is 5 or 6, they're doing that, or it's a 7-year-old and they still haven't understood that, you might start questioning whether this child, in terms of communication, everything is okay. Do they need better skills in terms of communication and stuff like that? So it depends on the age. If a 2-year-old does it, I mean, there's nothing you can do. It's a 2-year-old. If a 7-year-old is doing that, then that's also boils down to what I was telling you about styles of parenting. And understanding, and then being an appropriate disciplinarian, using the right things. And we know now that a lot of us had adverse childhood experiences because corporal punishment was included as a trauma.
So another thing to ask, due to COVID vaccine, there are problems that have started with vaccinations. What are the role of vaccination in raising a healthy child?
I think vaccines are very, very important. They're very big. If for once we put away the controversies and the politics and the emotions aside, and you just look at over the last 100 years what vaccines have done, and you look at the numbers of how many people died of this versus,
After the
we look
vaccine.
50 years of vaccination, how many have been averted? How many diseases have we forgotten about or we never see? It's very hard to see tetanus.
Yeah, like
nowadays.
some of as medical practitioners, it's hard to. I've never come across a polio case in my entire practice.
Yeah, it's those historical diseases that you hear about, that you should know about, but you've never seen it because of the impact of vaccination. Now, with vaccines, at the end of the day, it all boils down to science, and you have to look into the development of vaccines and the likes. And I think we're doing pretty okay in terms of the structures in place. And the issues have really been based on a lot of mistrust. Because anything that involves big pharmaceuticals, capitalism, and producing vaccines, because as much as we have Gavi, we have our WHO, these vaccines are developed most of the time by certain pharmaceutical companies based on billions and dollars of research. Because as a global community, we are not really big in research. We don't develop a lot. We leave it to capitalism. It's the way the system has been
evolved.
And then because people have spent billions, then they have to make their money back. So a lot of people have this notion that healthcare, it should be free, and the Hippocrates Oath and all that stuff. And it's true. And a lot of people believe that shouldn't be able to pay, and I also believe in that module. But at the end of the day, is also people need to realize that for these things to be developed, it costs a lot of money. Somebody bears the cost. Just because you're getting the vaccine for free when you go to a government clinic, yes, it's free to you, the citizen,
but it's not free to the government.
It's not free to the government. There's money that is being paid somewhere. There's terms and conditions somewhere about it. But you'll find that some of them are controversies that have a lot of salt. So misinformation, like I like to call it, a lot of snippets. A lot of people are pushing their own agendas where they can get fake doctors. Nowadays with AI, it's so crazy. I'm telling you, there are people who are going to take my face and I'll be telling people to take a particular tonic because of AI.
I've seen the video of Joe Rogan talking about a certain thing. And then I was so amused. Like, I know Joe Rogan, he doesn't talk about these things. And then I came to realize the whole thing wasn't AI, Joe Rogan talking. Yeah. It was just an audio of, an AI generated thing.
So there's a lot of things there. There's a lot of factual things. So with COVID, it's still, yes, there were those people who got side effects with COVID. And you see, the thing is with medicine, there's always rare incidences. I share, if you follow me, I share a lot of like positive stories, or maybe when I receive a baby, or we do a successful resuscitation and things like that, or a newborn delivery and everything has gone well. But there's also moments where things don't go well. It's not as common. They happen in our practice. The time you lose a patient, and when somebody or a surgery goes wrong, it's rare. It's extremely rare. That's why you sign consent, and most of the times we reassure you everything is going to be okay, but we can't tell you 100%
the outcome.
We're not God, so things can happen.
So on that note, still talking about vaccination, a friend was asking me about baby-friendly vaccination, and she mentioned an extended vaccines. What's the role of the actual guideline of vaccines and these extended programs that are given by private facilities?
So ideally, that's a good question. And I'll tell you what my teacher told me, who is also the president or the chair of Kenya Pediatric Association. All vaccines are baby friendly, because if you think about it, you want to get vaccinated to boost your immunity, so that when you acquire certain, or you're exposed to a certain disease, it doesn't put you in ICU, or it doesn't kill you. So whether it's baby friendly, whether it's the other government vaccines, they're all friendly to the baby. So moving into why there's a difference. So there's going to be a big change, especially in Kenya now, in terms of vaccines. There's even been shortages. We were once a low-income country. So when you're a low-income country, you through the Gavi, this is the Global Alliance for Vaccines. It makes the cost for vaccines for different countries on purchase much lower, and sometimes they also donate a lot of these vaccines. So now that we're moving away from that, I think we're now middle income into that category. So things are getting much more expensive, and also the type of support that Gavi can give these countries is much less, and that's also why we're having less antiretroviral medication. We're having less kits, reagents for doing the DNA and viral loads and things like that. If you look at what's happening with the HIV care, which is actually being a big problem, because we're seeing a resurgence in actual HIV cases. Before, people could do viral load, they could always check their status. Now there's that problem. So in terms of vaccines, again, now it's not that the ones in private, ideally we should get them, but it's also what can your government afford. And then research is done. We usually have our own body of research here that is run under Ministry of Health, but it's also a working group where they
determine priority wise.
Exactly, because right now in contention there's a push for introducing the influenza vaccine as part of the government program, so that people get the shots against influenza, because there's been a lot of fatalities of pneumonia. That is the viral is usually pneumonia, and a lot of RSV. So it's not that the private ones or private is just forcing kids to get unnecessary vaccines. It's good for them to have it as well. It's just that the government will prioritize based on certain research, or the prevalence of what's the prevalence of
this condition in this area.
I'll give you an example. The rotavirus was never included before in the national vaccination program as free. But I remember before it was introduced, I was an intern in Kenyatta, and we had so many babies dying of dehydration, severe dehydration, and going into shock. Yes, and as a result of rota. So it's after doing studies, they realized so many babies, we're losing so many babies over a disease that actually has a vaccine. So it was based on that research and based on the push. And then it was a big study done by KEMRI. So they introduced the rota vaccine. So there's a body that works on it, and they do all this. They try to make the decision based on research. Sometimes the government is receptive. Sometimes it depends, on what type of government you have. So they're all important. Unfortunately, if you don't get those ones, you go to private, but it comes at a cost. So that's the unfortunate thing. But I think as the country grows, as we become much better, then if universal healthcare is really, really taken seriously, then we'll see a change.
Wow, that's some good insight. So baby-friendly vaccines, we can say, is what your baby needs, and all vaccines are baby-friendly. If you can afford to have an extended vaccinations for your baby, like having influenza vaccines, well and good. If not, let your baby get the ones that are free within the government guidelines.
As a bare minimum. Those will be bare minimum. And you'll also find that sometimes when you're traveling now, maybe to the US or other countries, that some of the vaccines the US requires are not in our government program. Like maybe the meningitis vaccines, there's certain hepatitis vaccines that they require, and we don't give that in government routinely. Same way we prioritize, because we are not a rich country like the Western countries. So again, that also is sad to know that we could be covered, but because our government doesn't have enough
resources, we are not covered as much or as wide as we can be covered.
Wow. But we're getting there as a country, I think.
Another thing to mention is cases of vitamin D deficiency is going up. What is it that's not happening?
Yeah, vitamin D deficiency is really a problem. I think for me and a lot of us pediatricians nowadays, once we see a child more than 2-3 times coming in sick, whether they just have recurrent tonsillitis, whatever infection, pneumonia, one of the places that we always check is vitamin D, and we're finding actually we have quite a high number of vitamin D deficiency, not just in children but in adults. And what's even more sad is that, and probably a thing now we need to be pushing for also, we don't just give vaccines, we also give vitamins in the immunization.
Basically.
Yes. So for pregnant, we give the folic acid supplementation. And then for kids, we do the vitamin A supplementation as well. So now things like vitamin D, I think eventually will have to be put into place because we're seeing a large number of vitamin D deficiency. We're seeing a lot of rickets as well. And we're also seeing a rise in vitamin D resistant rickets as well.
Mm-hmm.
So ideally, what happens in the Western countries, which we say makes sense because they don't have sun, is for them it's a must. Like as part of your supplements, as much as you're breastfeeding, vitamin
also
D.
must supplement.
Yeah.
Vitamin
So
D.
for me personally, even for me with the mothers, when I discharge the babies home, I want to discharge them on vitamin D supplements, because it's not just for the bones. A lot of people think just vitamin D
is
for
one
the
of the
bones.
vitamins that's a hormone, basically.
Exactly.
Yeah.
So it does a lot, even for the
Involve
mood.
your immune system, your brain development, your bone density. I mean, people associate it with only bones and calcium absorption, but again, it covers wide the range than that.
They can have deficiency, and the kids will just look lethargic. They just don't want to eat.
So these recurrent infections and recurrent things that were not usual, it's as a result of vitamin D deficiency.
Well, it's one of the things that you guys
are seeing after doing tests.
Yeah. So
okay, will you say there is a correlation between vitamin D deficiency and the current lifestyle we have? Babies never touching grass or never going out.
Yeah. More and more people are living in apartments.
Yeah.
Where's the grass? If you're living in our urban rural settlements, yeah, you know how Kibra, how Mkuru he is just nearby here in the kijijis, that the houses are very close together. They don't have a playground. If my baby goes outside, it's the road and they'll get hit. So they'd rather stay inside the house.
So they're hardly getting exposed to the sun.
So of course there's there's no land to roam around and play around in like we used to. Then the other thing is, it's also important to say that the sun it can also be harmful. We still have skin cancers even in African skin. And there's a lot of debate about sunscreen. Some people have controversies about it. The more I'm on Twitter, the more I learn about people and their controversies, and how sunscreen actually, is really, really important. But if you're going to put your child 6 months and above out there for vitamin D in the sun for a long time, it's important to have, SPF 50 sunscreen as bare minimum to protect, because the ozone layer, climate change has been there. Our ozone layer that used to protect us. People used to tell me, you people are just pushing an agenda, you're trying to push products. My whatever never used to use sunscreen, how come they never got skin cancer? But then they don't look at the other protective things that our environment and our world had. And that's why the theme even for climate change was around health, the impact of climate change in actually our health this year at the COP28 that was there in Dubai. So, I mean, things are just some things. Those are some of the controversies and the misinformation. That's how we fight it. So if you're not going to put sunscreen, just know you are increasing the risk.
A risk of getting some form of skin cancer,
melanomas.
Yeah, but again, you get at least some exposure of the sun. Another thing is the role it plays on sleep.
Yes.
And setting your circadian rhythm.
Yes.
What will you say? How much sleep should a baby get with time, has that been decreasing, and does it have an impact on health?
I would say, it's so sleep it's a range. Again, we have 0 to 6 months, and then 6 to 12 months, and above 12 months. So the smaller your baby is, if you have an infant, you want them to sleep at least, you're looking at around 14 to 16 hours. They need to have naps. So they're waking up every 3 hours. They wake up, then they go back, they nap, type of thing. And then as from 6 months to 12 months, it reduces. 12 hours is usually good enough. Once they start becoming toddlers, you want them to at least have some 1 hour to 2 hour day naps. And then at night, they need to sleep at least 10 hours, at least 9 hours. School going children, at least 9 hours. So they should be in bed at 8. Especially now, what's affecting sleep is actually kids waking up so early in the morning.
Very unfortunate, yeah.
4 or 5 in the morning.
Going
so that
to
they can
school,
go to school.
you see kids standing alongside the road as early as 4:30, 5,
Yeah.
waiting for a bus, and probably they have slept 9 or
9,
even 10,
10,
11,
yeah.
trying to do homeworks and all that. There was a recent paper I read, which was really fascinating. One of the states in the United States of America is they increased the time a child can come to school from 7 to, I think, 9. So giving that an allowance of sleep, and then they realized the overall performance of the schools in that region changed completely because children were getting enough sleep. And then I associated it with another paper that says that they kept individuals for like 12 hours without sleep, and then they looked at the ability of them to retain information. And funny enough, not only to retain information, but the ability to even receive the information. And then they realized individuals who have not had sleep for the last 12 hours or even 24 hours are significantly not receiving information. So you're trying to wake up your child, rush him to school, disrupting their sleep. Will you say that will make the child not to gain anything from the school?
Exactly. So those are definite conversations that we need to have, because sleep is proven. The studies out there is numerous. It's the same way for you now that you're in fitness. If you don't sleep, if you don't get your 8 hours of sleep before the workout, your body won't be able to really recover. And if you don't start prioritizing good sleep and reducing the things that affect our sleep, especially messing around with your serotonin and your dopamine all the time,
and melatonin and all that,
from all the screen time and all that we consume.
What are the most common childhood illnesses that are frequent in these times, or in your practice you see them?
Okay, so the most common in our setting that could kill you or lead you in hospital in children under 5 is pneumonia. And it can be viral pneumonia, which is influenza, RSV, adenovirus, or it can be bacterial pneumonia, different bacteria. Malaria is still a big killer for kids under 5, especially in the endemic areas, lake areas, western areas, and the coastal, northeastern areas, where we haven't controlled the vector very well. Diarrhea disease, so rotavirus still, and different diarrheal diseases also lead to a lot of that. What else is usually a big thing? The common things that will get you to an outpatient center is your upper respiratory infections, and they're usually viral. And that's why, as much as it's not in the government, I really advocate for the influenza vaccines, the seasonal influenza vaccine that they update every year with the different strains of the mutations of the influenza virus. Because it's not that you'll never get those common cold symptoms, runny nose, but it means that your child won't be admitted with bronchiolitis or pneumonia and requires oxygen and all that stuff, which will eventually cost you money. Yeah, I think what else am I missing?
Considering
that-
you've mentioned pneumonia,
TB
uh,
as well. Oh, sorry, TB.
mm,
TB is also one of the things that's causing a lot of deaths in kids.
in kids.
Yeah.
So considering those conditions, what are the ideal, way a parent should approach it? What are the things I should have home at first before I even take my child to the hospital?
So it's I mean it's different things.
Fever management,
Yeah, they
for
should.
the dehydration, everything.
Yeah, they should have basic knowledge of, especially small children. So children die. Why dehydration kills is because they lose large volumes very quickly, and they don't have they don't have a lot of volume,
Reservoirs.
in their body. So it's important to know the signs of dehydration. It's important to know when your child is having choking, proper choking, and they're becoming blue or cyanosis. And then it's important for them to know between 6 months and 6 years about the importance of fever control,
Fever management.
because you can get febrile seizures or convulsions. So one is fever, at least know the basics. Fever is anything above 38 degrees. For smaller kids, it's 37, 37.5. These are the neonates and the infants. And then for dehydration, whenever your child is unable to take anything, and they're vomiting, they're not able to keep any fluids down, and they're having diarrhea at the same time, so watery stools, that already is, your child is at risk of now developing dehydration, because they can't replace the fluids and they're already losing fluids. So anytime that happens, you need to go and have the baby just assessed, and then they can tell you, okay, let's do this, or let's control the vomiting by this and that. So vomiting and diarrhea together, and the child not able to take anything because they'll vomit, that's something to warrant a parent to really, really worry. Now, if they have that, and the child is now looking sleepy all the time, tired, or what we call lethargic, their hands are starting to feel a bit cold, then it's an emergency. Then they need to rush the child to the hospital. And of course, the other is a seizure. If anytime your child has a seizure or convulsion, most of the time they become stiff. Their upper limbs, lower limbs become stiff. They can gaze upwards. You try to call them, they're not responding to your voice. It's like they don't know you. Sometimes a few seconds. It happens very, very quickly for the parents, because you're in so much shock. So you can't really time it. Us doctors like to ask, so how long did it last? But in reality, because it's you don't really understand what's happening. It's such a
you
shock
cannot
for
gauge the duration.
Yeah, you're in so much shock. So you can only assume, but don't ever take, when a parent tells you, no, it was 5 minutes, because some will tell you 30 minutes, because for them it felt like it was happening for this. It took that long, but sometimes it's just a short thing. So yeah, I would say those are the things that parents need to look out for.
And something, a key point also for the parents. What will you say? How should I balance between my health and the health of the child? Between my work, my health, and the health of the child again?
So kids are like sponges. If you have a healthy parent, so if you're healthy, mentally healthy, physically, you take care of your body, you try to eat well, you're in a nurturing environment, in terms of in a good relationship with your spouse, then that's a good environment for the child to pick up healthy habits. It's very hard if you're not going to the gym, you're not working out. Your child can see that you're big in size, but you want your child to to exercise, to not sit on the TV all day.
You cannot manifest what you are not.
Exactly. So if you're going to be on your phone the whole day, don't expect your child to be on the iPad for only 1 hour a day, and you're just on your phone, or you're just on the TV. Yeah, they'll realize that. And then the work part, I don't know. There's the common thing is work-life balance, but it's really hard. It's really hard for some people, based on the type of work they do.
Wow, yeah, that's so true. And it's really hard to either make the child the priority or even the work the priority. You find out that there are recently videos which are trending, and you see a child is way more connected to their caregiver, the nun at home, more than they are connected to their parents.
Yeah. Sometimes not by choice, because
It's by circumstance.
I see many kids who maybe the parents they're in Saudi Arabia, or they're working somewhere outside, and they're with one caregiver. It's always going to be different, but I think parents need to be more conscious to the fact, or cognizant to the fact that if you leave your child with a nanny to perform a role that, even if it was you alone, to clean the house, to wash the dishes, to take care of your baby, that it won't be easy. So it's still very tricky, but sometimes you don't have a choice. Yeah.
To digress from pediatrics and go maybe into general health, health and fitness, what's your thought on that? Because you're someone who, personally, if I talk about, you have inspired me to go to the gym, to make some changes in my life, and I've been following you for a very long period of time. What will you advise?
Hey, first of all, I think even when we put this out, you should put the before and after pictures of your fitness journey. So for me, I feel good, because it was a turning point for me when I was 30, and I started late to start getting into fitness, but I've started looking at it as a lifestyle. I've stopped putting pressure. The mistake a lot of us make is that we're not happy with maybe the way we look, or you have now high blood pressure because you've gained too much weight, and then we set unrealistic
objective
goals. Yeah, although yours is a different case, because you smashed all your goals in a very short time. Because the thing is, you want to set it as part of your life. And life is full of ups and downs. Yeah, so if we put it at linear and say in 3 months, in 6 months, I want to lose this much weight, and then if you do set your mind to something, yes, you'll do it. But then, are you doing it
at
just
what cost? Yeah,
at that 6 months? And then when you reach that 6 months, what happens now?
What's after,
now that you've done it?
Because I have seen so many individuals who are worried about their weight, and then they just follow a strict diet and start doing messy habits, and then in 3 months, in 2 months, they lose significant amount of kg, and then they realize the next 4-5 months again they gain it back. What is the essence for you losing it in the first place drastically like that, if you're going to gain it back? So we overestimate what we can do in a year, and I underestimate what we can do in 10 years.
Exactly.
So your approach is consistency, and for a longer period of time.
Setting long-term goals. So for me, I set, like, when I turn 40, which is now very soon, in like 3 years, there's a certain physique that I'm yet to achieve. But if I look at the journey where I've come from, there's a significant difference. It's all about understanding your body. It's about educating yourself. A lot about is self-educating, and a lot of people tend to think because you're a doctor, you must know all these things. You must know about nutrition. But the funny thing is, as we were talking,
minimally understand nutrition.
We don't talk about nutrition in medical school. We don't talk about protein. We don't know about creatine, but we know about creatinine levels. So it's one of those things you have to educate yourself. And like you said, it's a mindset. So for me, I had to like change my attitude towards things. Like for me, I don't put sugar in any of my
beverages.
Like tea and coffee. I have it without sugar, and it became normal. But I had to change my mindset. Things like sodas, I can't drink sodas, and if I do, I try to go for the zero sugar. Yes, there's still more controversies about.
There's so much controversy, and funny enough, I went down the rabbit hole trying to research on that thing, and people say it contains sugar. One, it doesn't contain sugar; it contains aspartame. And people are like, aspartame is carcinogenic. And then you realize, okay, it is. Let me do more research and find out. and then you realize, yes, it's carcinogenic, which means it can cause cancer. And then you realize it's under which category, and then you realize it's in category, I think, C, which in the same category is meat and other things also.
Yeah.
So before you start hyping something, saying this thing is bad because you just had it's carcinogenic, maybe it's time you should check also at what level of carcinogenic it is.
Exactly.
So personally, I do a lot of aspartame containing drinks, Coke Zero and the likes, and mainly just to avoid extra calories. You just take in unnecessary calories. If I'm taking calories, let them be from meat. Let it be from no harm to vegans, but I'm saying let it be from a source that's having other important values in your body. Okay, let's, for example, there's something you mentioned, vitamin A, vegetables. They still give you calories, right? They also have other importance.
Exactly.
So consume things which are important to your body at the same time giving you the calories. Don't drink calories for no apparent reason. I
had to learn that. At some point I had to be able to do, like, where you count your calories today. How many calories have I eaten? Trying to calculate the calories of the food you're taking. So and I remember myself those days when I used to do that, and it used to stress me every time you eat, because but I had to learn about every time nowadays I gauge usually. I roughly, okay, I've eaten this, or I've had a muffin, or I've had this, then okay, I've had enough sugary stuff today. Maybe I'm not touching this for another.
Ideally, that's how it should be. We balance things than living in a restrictive life. Okay, do something for the longevity.
Exactly.
For the the amount of time you can do will not have a burden to your mental health and everything else. Again, to mention something, there's so much misinformation. There's Twitter talks about health and this and that. What's your advice for the general public on what they should perceive as an information?
So what I tell everyone is that, even there's a lot of people who just follow me now and on Twitter, and they'd be like, just go and see listen to what Dr. Rain says, or listen to whatever. But at the end of the day is whatever information that you consume, whether it's coming from somebody who is a doctor, because now we have a lot of misinformation from doctors as well, or people who claim to be doctors.
Yes. But one thing, let me interrupt you, is even if you're a doctor, if you become over obsessed because of a certain information, then your aspect of being doctor has just gone away. Because one of the key things about doctors is we never go to an extreme for anything, isn't it? Everything is a balance, just the way you mentioned, the child screen health, not giving them screens because screen is for learning. You as a father, you had that reasoning because your knowledge has given you that ability to reason. But when you're a doctor and you just decide to say phones are bad, and your child never touches a phone until they're 15-year-old, what kind of human being are you bringing to the world? Same thing. Continue.
And it's very many things that can make a doctor have or give biased information, even when they know the research, they know the science. Culturally, the way we are brought up, it can conflict. Religion also can conflict into making a lot of decisions, of scientific decisions as well. Political views. You've seen people who are professors and but when you hear them talk about certain political views, you wonder, is like, is this really an academic or whatever. So those are things that what I encourage people is, not all the information is the same quality to recommend. There are different types of evidence, and you always want to go for the one that has the strongest
argument and evidence.
What you'd read from a Twitter post or a YouTube video, or what you'll read from a scientific journal, and the different studies of different journals is what will determine where the information is likely to be more correct. So it's important not to be emotional. Misinformation targets a lot about our emotions. Like, for example, as soon as the story about GMO started coming in place, I started seeing Twitter has that habit though. Once GMO is spoken about, everybody becomes an expert.
An expert, yeah.
Once we talk about COVID, then everybody is a virologist and immunologist, and they know all about vaccines because it's like they've known it for so many years, the way they speak, and they'll start quoting things based on a YouTube video they watched or a tweet that was seen. So it's all about just making sure that it's just because I'm a doctor, yes, it helps. But as long as I'm telling you this information because there is WHO, this, or there's this research saying this, and that's why I'm saying it. I'm not saying it because I'm Dr. Rain and I'm smarter than everybody else.
Yeah. Doctors are not smarter than you.
Yeah.
And anyway, what are 3 advices for the parent? Final question, maybe.
For the parents, love your child. Before you get kids, make sure you're getting kids because both of you want the kids. Because sometimes maybe one wants and the other one is not ready. Be patient before you decide on bringing life into this world. Because if you people are not ready psychologically, you're going to affect this child, and by affecting the child, you're going to affect the way they grow up as an adult and the type of productive citizen they'll become. So for parenting, then it's just keep continue the good fight. Parenting is not easy. It takes a lot of sacrifice in parenting. It can either make you or break you. So just look at the positives of parenting. That's what I would say.
Thank you, Dr. Rain. Thank you for coming and joining us today and educating the masses. It's one of the incredible work that you do for the society for the globe. We'll provide your details on how people can reach you if they require pediatric consultancy and to discuss with you about the upbringing of their children. I'll provide your links to your social media accounts and even your contacts under the description below. And I'm also telling the listeners and the viewers to tune in once again. We'll have more consultants in. We'll discuss matters about health and ways to improve your health. And consider subscribing to this channel or listen to this podcast always. Thank you.